I'm Dr. Michael Banman with Align Life Medical. I have a question for you today. Can you bend as easily as you once did? Do long car rides make you feel stiff and arising in the morning? Are you able to spring out of bed, or do you ache and groan when you're getting up? If you have any of these symptoms, unfortunately, these are the signs of aging and very likely involve arthritis. For there are few human beings who don't suffer from it by the age of 40. Yeah, the age of 40. There can be sharp shooting pains as well as an aching or throbbing. Arthritis affects the cartilage and tissue between bones. It can sometimes feel like the bones are grinding against one another. Inflammation of the connective tissue, cartilage separating the joints, and ligaments holding the bones together usually causes most of the pain. While osteoarthritis could be considered the wear and tear of joints, there's another form called rheumatoid arthritis. This second form normally occurs when the joints are attacked by an autoimmune disease. Depending on the severity of your condition, we're confident in our ability to help not only with the pain management, but with the inflammation reduction and tissue repair and regeneration through regenerative medicine. In the US, osteoarthritis is the leading joint disorder, back pain being the biggest problem in the US, and it usually involves arthritis. Thanks to aging, our diet, sedentary way of life, and obesity, we are the most obese nation in all of the developed countries. The problem is only expected to get worse unless we develop a health maintenance attitude and commitment rather than wait until it becomes symptomatic and then try to handle it. It usually cascades into an ever worsening condition by then, requiring more serious management and treatment. When it comes to joint arthritis, there are several causes and factors that worsen the problem. This includes old age, knee injuries, bone density, weak muscles, repetitive joint use, obesity, joint laxity, and it affects men and women equally. There are means in chiropractic to prevent and reduce the risk of osteoarthritis by altering these factors. I should note that aches are a normal part of life after long days and exercise. So how do we know when the problem is more severe? Is the stiffness more noticeable after long periods of inactivity or after waking? Do you have swelling? This could be a buildup of fluid. Do you experience a sharp shooting pain or perhaps a dull ache for prolonged periods? Have you lost range of motion in a specific joint? When applying light pressure, does the area feel tender or sore? Does it feel as though the bones are rubbing when the joint is moved? Grating or creaking noises may be heard. Is there pain upon movement, worsened after you have been sitting or immobile for a while? Is there stiffness and restriction of motion? With any of these symptoms or a combination of many, there may be a more serious underlying problem. If you see a doctor for this problem, the odds are that you will be prescribed an anti-inflammatory and a painkiller. This is American healthcare, alleviation of symptoms by drugs or by surgery that's invasive, rather than handling the source. It is actually a disease treating or maintenance system rather than curative. Some may recommend adjustment of your lifestyle if it is contributory to your condition. Proper food nourishes the body, including the joints and all bodily tissues, and the quality of the food determines how well fed your bodily parts are. Exercise moves the joints, causing nourishing and lubricating fluids to reach the joint and keep it healthy, cleaned out and well fed. So proper diet and exercise is vital. When the pain and discomfort is so severe, medical doctors may recommend surgery. The present state of American healthcare is alleviation of symptoms by drugs or by surgery that's invasive, rather than handling the true source of the problem. It is actually a disease treating or maintenance system rather than curative. We believe in getting to the source of the problem and curing it, not just treating it. Without drugs or surgery, except in ultra serious conditions of intractable pain, that's our goal for you. We have in our integrative clinics a means of determining the real cause of your ailment and a drug-free means of treating it without surgery unless totally needed. First, we have our adjustments that usually reduce pain or use bracing to remove the pressure from the damaged or injured part. Then we do regenerative therapy with stem cell, platelet-rich plasma, and hyaluronic acid injections. If we take stem cells as an example, these cells can not only reduce inflammation and deal with the effects of osteoarthritis instead of anti-inflammation or anti-inflammatory drugs, but we know that inflammation is the way that the body heals itself, so these regenerative procedures are helping your body develop its natural healing system. Once stem cells are injected into the affected joint, it could help to form new cartilage and therefore provide the cushion for the joints what they need, and thus it will finally remove pain and discomfort. How will a typical session go? First, you'll start with a consultation where we'll assess the affected joint or area. From here, we'll work towards a cause and then develop a treatment plan. As mentioned previously, we always aim for natural solutions that produce relief and resolution of the condition once and for all. If you have any questions, please comment below. And as always, we'd love to hear from you.